Now, when it comes to your choices for coverage, it comes down to two major options. You have your Medicare supplement policies and your Medicare Advantage plans. Let's talk first about the supplement policies. Under Original Medicare, you have Part A and B, and you're able to add Part D, as we mentioned before, for an additional monthly premium. In this scenario, Medicare would generally cover you for the 80% of your healthcare cost, and then you're responsible for the 20 remaining percent of your services. Under Medicare supplement plans, these are also known as Medigap plans, by the way, that's a term you might have used. They essentially what they do is that they pay for all or some of the cost of your 20% responsibility. In other words, they supplement the gaps in Original Medicare. If Medicare doesn't cover the services, then generally your Medicare supplement plan won't cover it either, so you must remember that. And then you would have to pay for the services out of pocket. These are policies that are sold by private insurance companies to Medicare beneficiaries. The plans are standardized and the prices may vary depending on where you live. Under Medicare Advantage plans, however, you will also have Part A and Part B coverage. And most of these MA plans include a prescription drug benefit to it, and many also include some extra benefits that Original Medicare doesn't cover. We mentioned before that these benefits can include things like dental, vision, over-the-counter services, transportation, etc. Now, many Medicare Advantage plans also have a lower out-of-pocket cost than it would with Original Medicare or with a supplement, and you don't have to pay a monthly premium or yearly deductible in most cases.
So the next question is usually, is it better to have a Medicare Advantage plan or a Medigap plan? Whether you choose to apply for a Medicare Advantage or Medigap depends on your needs. One of the benefits of having Original Medicare with a Medigap is that a person may go to any doctor who accepts Medicare.
Yes, that's true.
People who frequently travel within the country may find this option beneficial when wanting to have a routine doctor visit while traveling. Some Medigap plans may also pay for emergency health costs outside of the US, which may be valuable to some individuals. There are, however, health issues and treatments that Medigap does not pay for, including your long-term care, private nursing, dental care, hearing aids, vision care, eyeglasses, and some other extras that are covered by Medicare Advantage. Additionally, Medigap premiums may increase every year. As mentioned, Medicare Advantage plans give you the opportunity to cover coverage for benefits beyond Original Medicare. This may include routine vision and dental, hearing, and health and wellness programs. Normally, under Original Medicare, you'd pay for these services out of pocket unless you have other insurance. Another benefit of Medicare Advantage is that many of these plans also include Medicare Part D prescription drug coverage as part of the plan coverage itself. Now, these plans give you the convenience of having all of your Medicare benefits administered through a single plan. So if you enroll in a Medicare Advantage prescription drug plan, you will not need to enroll in any additional prescription drug plans. In fact, if you enrolled in a Medicare Advantage plan that has Part D coverage and enroll in a Part D plan, you can be disenrolled from your Medicare Advantage plan.
Well, thank you so much, Stephanie. You know, we've covered a lot of information. What do you think are some of the key takeaways in this?
So some important things that we have to remember. Original Medicare provides good basic healthcare coverage, but it pays only about 80% of approved costs for hospitals, doctors, and other medical procedures, and usually does not cover prescription drugs or such things as routine dental care. Now, Medigap supplemental insurance plans are designed to fill Medicare Part A and Part B coverage gaps. Medicare Advantage, also referred as Medicare Part C, includes benefits beyond what Medicare Part A and B give you. So these plans are offered all by private Medicare-approved insurance companies. Now, although Medicare Part D prescription drug coverage is optional, if you don't get it, either as a standalone plan or as part of the Medicare Advantage plan, there may be financial penalties if you need to buy a policy later. And make sure, it's very important that you consider plan cost, your plan doctors and convenience, your lifestyle and your travel plans, your health plan and any additional benefits before making your Medicare coverage choices.